All right, if you are watching this, it's because you have been enlisted to judge for the 3-minute thesis competition at University of Buffalo. First off, that's a great honor. I've competed in the 3MT competition at UB myself and also judged at UB. It's a great event. It's a lot of fun. It's also, an important role because you are deciding who wins the competition. This video will be pretty short, about 10 minutes, and I'm just going to walk you through sort of expectations and the rubric. So first off, here's the rubric. This is the actual rubric that you will be using. It's broken down into 4 components: verbal communication, visual communication, comprehension, and engagement. So if you're not familiar with the 3MT competition, it's a competition for graduate students. Their goal is to explain their research project in 3 minutes or less. It has to be under 3 minutes. They have one static slide. There are no animations allowed. So looking at this rubric, you can see that the first part is the verbal communication. It's basically asking, how clear were they in their spoken presentation? Obviously, ideally, there should be no jargon, or if there is jargon, it should be clearly explained. In an ideal world, there should be nothing that the presenter says that you scratch your head and think, what the heck was that? A 10 out of 10 will be a presentation that is just glides all the way along. There's nothing in there that you get confused about. Whereas a 1 out of 10 would be like sitting at an academic presentation and hearing scientists talk amongst one another and use nothing but jargon. The visual communication piece is about the slide. And this is a tough one. Judging the slide is tough because there's no universal ideal for what's a good slide. A good point of reference here is a 10 out of 10 slide should be something that enhances the quality of and the clarity of the presentation. So it actually helps you get more out of the spoken presentation. It doesn't distract you from the presentation. It was, nice looking, and more importantly, it was clear. There wasn't anything on there that was confusing. But keep in mind, there's a lot of different types of slides you can use. As a general rule of thumb, you don't want the slide to be overly complicated, because if the slide is distracting and it's pulling the audience's attention away from the speaker, then that's not good, right? You generally want to see a good amount of blank space, not that much text. The visuals should be clear. But again, there's no such thing as the perfect slide. I've seen people use a slide that is just one image, just a static image of space or something like that, right? Takes up the entire screen. Sometimes that's a really good slide, but ideally the slide should add something to the presentation. It shouldn't just be a backdrop. Usually the best slides have a couple graphics and everything is very clear. And by the end of the presentation, you say, I totally get it. I totally understand every decision made on the slide and why every single thing is up there. And ideally, and for a 10 out of 10, the slide actually helps you understand the spoken part better. Okay, comprehension. So comprehension is not just about, did you understand the speaker and what they were saying? It's about the research. Did the presenter explain, here is my research question, here is how we examined it and the tools that we used or the approach we took scientifically, and here is the result that we found, and here's how this impacts the world. What comprehension is basically about is, did you understand what they were explaining? So once again, this is kind of nuanced because you might think a 10 out of 10 is something that just glides along the top surface of research and doesn't really dive into the details, but that's actually not ideal. You don't want to give people so little information just to make it clear. Ideally, a good presentation should teach you something. I think the best 3-minute thesis pitches, they do a good job of comprehension because they actually teach something complicated in a way that's clear and understandable. So a 10 out of 10 is not something that just glides along the very superficial layers of a presentation and doesn't go deep. It should go deep a little bit, but in a way that it makes it clear. Okay, and lastly, engagement. This is about, how good of a presenter are they? Are they engaging? Did they use emotion? Did they hook you? Did they kind of show personality? Did you want to keep on listening to them because of the way they were presenting the information? So how much energy were they infusing? Were they excited? Did they make you excited? Was the emotion appropriate? So the question is really, was the presentation style thoughtful and engaging, and was it presented in a way that really clicked and resonated with you? Okay, let's look at some examples.
Have any of you had a difficult time accessing primary care? Primary care can be delivered by physicians, physician assistants, and more so than ever, nurse practitioners like me. I'm a nurse practitioner, a primary care provider, and a teacher of nurse practitioners. And that's why I'm invested in addressing the lack of access to quality primary care by graduating practice-ready family nurse practitioners. It's not just increasing the number of nurse practitioner graduates to address our national shortage of primary care providers, but making sure that they're prepared to care for a population that's more sick. Students are getting very different experiences in their clinical sites and it might not be sufficient to prepare them for practice. Imagine if you get some scans that look a little suspicious for cancer, and you're working with a nurse practitioner who never had a learning opportunity to practice how to share bad or unexpected news. One promising solution to address these gaps in learning and evaluating students is something called objective structured clinical examinations, or OSCE simulations, and I'm just going to call them role plays. This role play teaching activity is used to practice running an appointment with an actor playing the patient in a controlled and a safe setting. The role plays are perfect to experience situations that don't happen very often, but are high stakes. As a doctoral student in nursing education, I explored what students think about these role play experiences through a qualitative study. I did this research with the purpose to improve the role play experience for students and to inform nurse practitioner programs how to best implement their role play programs. When I interviewed recent family nurse practitioner graduates, I learned that they really enjoyed the role plays and they thought they were worthwhile. It allowed them to practice the nurse practitioner role, the flow, the words, the technical skills that they then transferred into their clinical learning environments. One participant in my study told me it was like a dress rehearsal. Going through the role play prepared them to step confidently into that role once they were in clinical environments. Some of the routines students developed when they were preparing for and performing their role plays were actually routines that they were still using in their first jobs. And ultimately, students felt that they were better prepared for clinical learning as well as their work because of the role plays, and they ultimately wanted more of them. The results of the study helped me make the suggestion to other teachers that following best practice guidelines was really important for students to learn and to be invested in the activity. We need practice-ready primary care providers, and nurse practitioners have a proven record of high-quality, safe, and cost-effective care. And as a teacher, I want to ensure that nurse practitioner graduates are ready for complex patients, and my research supports that these OSCE role plays can fill gaps and make graduates more prepared to address our health needs, especially in rural areas throughout our state of Maine.
All right, so let's go through this. I mean, one thing you're going to learn immediately is that everybody scores differently. You know, your experience watching that presentation was probably quite different from mine. I'm going to tell you what my impression was of that overall presentation and kind of where I'd score it. That doesn't mean that you have to agree. You know, what I found in my experience of being a judge at the 3-minute thesis was that the judges often didn't agree. It wasn't one-to-one that we all had the exact same scores, but that's why there's multiple judges, because then it averages out. So let's start at verbal communication. Did the presenter use language that could be understood by a non-specialist audience? Yes, absolutely. I don't think there was really anything in there that, maybe a word or two that were, beyond the understanding level of the average person. Any jargon was defined, when he said OSCE, and I forget the acronym, but he explained exactly what it was. And then he said, I'm just going to call them role plays. I thought that was great, because why confuse the audience with OSCE simulations when you can just say role plays? So I would get that one a very high score. I mean, I think the communication was excellent. Visual communication, this is really just talking about the slide. I thought the slide was pretty good. I thought maybe it would have been more effective, to show like let's say an image of a nurse talking to someone about something difficult, having one of those difficult conversations, with an arrow that says something like, better care. That's just my opinion. I mean, I think there was an opportunity to capture some of the emotion around this sensitive topic, and it was instead a little bit more like logistics and showing kind of graphics, and it was nice and clear. It wasn't overly populated, and it didn't distract me from the presentation, so I would still score it pretty high, but I might dock a point or two for the fact that it kind of missed an opportunity to engage emotion a little bit more effectively. Comprehension, was the significance of the research made clear? Absolutely. I really appreciated that the presentation went into significant depth into certain findings. It probably could have been presented in a little bit more of a linear fashion. Still very well presented, but I would probably score that one closer to between satisfactory and superior, maybe a 7. And then finally, engagement. I thought the presenter was very engaging. I thought from the very beginning, he was very personable. I would score quite highly. I think I would say maybe an 8 or a 9 for engagement. So that would ultimately amount in a pretty good score. Now let's look at one more.
Have you ever wondered how fast your reaction time is? Let's find out. On the count of 3, clap once as quickly as you can. Nope. Not yet. On my count. 1, 2, 3. That quick reaction, a perfect harmony between your brain and body, is something we often take for granted. But however, there are millions of people with Alzheimer's and Parkinson's disease whose slowdown becomes a daily reality when they can't do such reactions. Simple things like walking smoothly, clapping your hands, or remembering these wonderful faces become increasingly difficult. Right now, doctors rely on very expensive brain scans and invasive tests that only provide a brief snapshot of what's happening in your brain and body. It's like trying to understand an entire movie's plot from just one pause scene. Clearly, we need a better way. My research addresses this gap using two powerful tools: artificial intelligence, AI, and everyday physiological signals. I measure physiological signals like brain activity using a portable EEG headset, your heart rate activity using your smartwatch, and your walking pattern using video recordings. Then I train AI to act like a skilled detective that constantly spots clues in changes in someone's daily movements, their speaking patterns, or even their typing speed. It learns what normal looks like for each person so it can detect tiny shifts long before they become noticeable symptoms. But I'm not stopping at looking at these signals individually. I'm also exploring how these signals interact with each other to provide a richer picture of the brain's communication network. Imagine your brain and body as musicians in an orchestra. Usually, they're perfectly synchronized. In Alzheimer's or Parkinson's, though, some instruments gradually fall out of sync or stop playing altogether. By tracking these disruptions, we can spot early signs of disease progression a lot sooner. This early detection matters enormously because it means interventions like drugs and other treatments can start sooner to reduce the damages diseases can cause. Imagine being able to track your brain health as easily as you can see your daily steps, or even knowing your heart rate activity right from the comfort of your home. Okay, now, let's finish with one more synchronized count. On my count. Ready? 1, 2, 3. Next time you clap, whether cheering at a game or celebrating a loved one's celebration, remember, these are the moments I'm working so hard to protect. Thank you.
Okay, that's a very good presentation, right? I think we can all appreciate that that was exceptional, and that was, in fact, the first place winner from Stanford University a year or two ago. So let's go through this again. This time I want to start at the bottom. I want to start with engagement because she is such an engaging speaker, and she used multiple exercises throughout to engage the audience, right? The 3, 2, 1 clap. It's terrific. It gets people to buy in. It gets people to perk up. You could see in the audience when they pan to the audience, everyone's sitting there like this, like ready to clap, so excited. So much better than just sitting there and listening. So engagement, 10 out of 10. And, sometimes this happens where you watch a presentation, then you watch another one, and you think, I just said a minute ago that I would have given the previous presenter an 8 or a 9. I would probably drop that to an 8 after seeing this one. That's just my opinion. I think, you obviously want to score them relative to each other. And when I was the judge, I actually did that. I went back and I changed some of my scores after hearing a few more. Okay, anyways, now let's go back to the top. So verbal communication, the language was very clear. There were a couple things. I think she said, I'm using EEG recordings. I know what that is because I'm a neuroscientist, but most people might not. It was still very good. I would say, basically I would dock points here if there were times where jargon was used that was not necessary. And I didn't think that happened really at all. So I would give that a very high score. Visual communication, looking at the slide, I thought the slide was very good. It was engaging, the image on the left side. Overall, I think the slide maybe had a little bit of room for improvement. I wouldn't give it a 10 out of 10. There was a little bit of complexity to it that probably could have been simplified, but I would give it a very good score. And then comprehension. Do you feel that you understand the research she is conducting? I have a pretty good grip on it. And so I would give it a pretty good high score there as well. You're going to see a range of presentations some are better than others. And, your goal and your job is to basically score them appropriately. And, it's okay if your preferences are different from mine and the judge next to you. It's all about you are a layperson. You are the representative member of the audience. Do you understand the way that they explain their research? Did it register in a way that was meaningful to you? Did they engage you? Was it clear? As long as you follow those guiding principles, then you're doing a good job, and it's just about scoring what's true to you. So I hope this was helpful for understanding the rubric and how to approach these presentations and maybe setting your expectations for what you might see. And I'm wishing you a great time at the event because it's really a lot of fun. So congratulations on being selected as a judge, and I hope this was helpful.